I'm George Dangas from Mount Sinai Medical Center in New York, professor of medicine, and part of the executive committee of the large TWILIGHT trial that was recently completed. I'll be discussing with you today the specific secondary analysis of this trial, so-called TWILIGHT-Stent, that focuses in the different drug-eluting stent types and how they did throughout this trial. The main goals of this TWILIGHT-Stent analysis was to look into the three main groups of contemporary drug-eluting stents and see how the results came about regarding ischemic endpoints and bleeding endpoints among these three groups that we chose, and how the randomization platform worked within each group, so to speak. And the three that we chose were the biodegradable polymer drug-eluting stents, the durable polymer everolimus-eluting stents, and the durable polymer zoltrolmus-eluting stents. The key findings of our investigations can be organized in two main groups. Number one, we compared major adverse cardiac events due to ischemia as well as bleeding events among the three large drug-eluting stent groups, as explained. And in general, we found that there was no major differences among the three groups in ischemia or bleeding, and we find very low stent thrombosis rates with all the platforms, with naturally minimal differences, because it's very difficult to detect a statistical difference when the event rates are so low. And again, just to clarify, the time frame was between 3 and 15 months after randomization. So this was more of a late stent thrombosis assessment, so to speak. Very encouraging. The other aspect is that within each one of the drug-eluting stent categories, we examined how the Ticagrelor Monotherapy worked out versus Ticagrelor plus aspirin. And again, this was a double-blind, placebo-controlled investigation that commenced 3 months after an initial dual antiplatelet therapy of aspirin and Ticagrelor after the index PCI. And again, the overall patient population had to have at least one angiographic and at least one clinical high-risk criterion, just as a reminder of the inclusions of the main TWILIGHT study.